Um, so I'm here with Yana. She is a tennis player who suffered a labral tear. So after further testing, I've come to the conclusion that you have you've mentioned that you have a 5 on 10 pain in internal and external rotation of that hip in a close kinetic chain. So you're planted doing that internal and external rotation. That's what's bugging you. That's where your pain is. Just a quick little run through of what the hip is and what joints comprise the hip. So basically your leg muscle here, you're not your leg muscle, your bone is your femur, and your head of your femur, which is a ball, fits perfectly into your pelvis, which is a ball and socket joint. So the acetabulum is just that hole, that crevice in your hip. That ball fits into that crevice perfectly, and which allows you to rotate and perform your sport. So when you're playing tennis and you're moving, you're cutting, you're reaching, that leg, that outstretched leg, allows you to go get that movement. So when you suffered a labral tear, the labrum is basically that layer within the acetabulum and the head of the femur that kind of acts as that barrier or that protection layer, allows for that head to properly rotate smoothly, but it also compresses, it dampens the compression. So in your sport, as you're stepping, that compression, that'll irritate you. So if there's a labral tear and there's no more labrum, you can imagine that there's some bone on bone that's really irritating you while you play. So we're here to help that. Also through testing, we've seen that in a single leg, you're very wobbly. You've reported pain, which is approximately like a 2 on 10. But as I see you, you're very unstable in that position, in that one-legged position. So your pain is decreased, but there's a lack of stability. And as I further tested you, your glute is very weak. So we can properly try to like strengthen your glute, which will stabilize your joint in that extension, anything flexion to help pull back, and also adductors. These adductors are muscles that come insert all the way into your pelvis and help pull that pelvis in, help pull that leg in to again help stabilize that ball and socket. So I think strengthening your glute and strengthening adductors and a bit of quad will help keep that ball and socket nice and snug within that. And we can do that through rehabilitation, so some banded work. Right now, I'd start you off maybe, since you report no pain on a single leg, maybe we can go no weight, like not no weight bearing, but very light on that single leg, just for you to feel for that pain for a sense. But for you, I'm assuming your mechanism, since you do a lot of cutting and reaching, I guess, or on that outstretched leg, you probably overreached and you felt a little pop in that labrum, either in your back leg, in that anterior dislocation, so here, and this hip is popping anteriorly, or in really outstretching here, having a very excessive external rotation and abduction. You're here, that hip can shoot forward. So I'm assuming either one of those is a viable mechanism for you. But again, through rehabilitation, we'll start off slow and constantly progress you as we move forward. So I'm hoping to work with you.
Thank you.
Okay, that's a wrap.
Along with